All right, so activity one that I want y'all to engage in is simply having your child sit in a normal fashion. That'll typically be in this ring-seated position. It may be full crisscross, but primarily your aim is to start high up and just decrease your hand placement until eventually we're all the way down on top of the thighs. That'll require her to engage her tummy muscles, both front, side, and even the back. So you'll have the corset of muscles all activated. From there, what I would like y'all to do is go ahead and go up against the back of a couch and play hands to feet in this position. You may have to guide hands to feet and feet to hands, but go ahead and just get the child acclimated to this positioning. If you want, you can then bring them down afterwards. And from here, from a side view, I'll go ahead and lift the bottom high up in the air and encourage the child to play hands and feet in this fashion. It's going to be a bit of a different stimulation because now weight is more gravity pressing down. Skin of her back and the back of her head has a bit more input than when she's a little more gravity minimized at this angulation. Another thing we'll note is that when we lift the bottom off the ground, it causes a bit more engagement in the abdominal musculature. So I really like that with this foot to hand and eventually a foot to mouth, because it's not just hip flexor activation causing that leg to come up to the chest, it's the abdominals bringing it even further. So after that activity, when the abdominals are engaged and when she's comfortable going up into this position, what we'll go ahead and do is we'll facilitate rolling. So you can do this in a couple types of fashions. We could do it segmental, where there's rotation of the spine, or we can do it non-segmental, where it's a roll all at once, so the spine doesn't rotate. And how you'll encourage the non-segmented roll is encourage hands to feet, and from here, when the child starts to rock, occasionally they'll accidentally go onto their side at first, and that's completely normal, and they'll start to realize, oh, I can start to go on my side from my back, quite simply. From here, they might require a little bit of prompting or cue to go onto their stomach. You may have a toy, and don't just put it straight in front of their line of sight. You'll want it straight and a little bit upwards too, and that'll give a bit more encouragement to straighten everything out and go into that slight extension, because the child will be looking up and at the toy. So you can guide them back onto their back, and you can continue that process, hands to feet, non-segmented roll, going all the way onto the stomach. And then from here, if you wanted to do any prone play activities, you can prop them up onto their forearms and their elbows, and you can, with their head being lifted, you can have a toy in front of them and go ahead and get them to start doing a rotation of their neck and head while they're in this position. Eventually, they'll start to learn that they can weight shift. More weight on left elbow, more weight on right elbow, and that will eventually progress to where they can reach for an object as well. So we're talking further down the line, progressing, but going back to the rolling, if segmented roll is now what we're shooting for, where there's a rotational component, what we can do is we can bring their leg up on one side and straighten the other side. We'll then drift the bent leg over to the direction we want them to go. Initially, everything will go pretty block-like, similar to the non-segmented roll, to where everything just shifts at the same time, and they'll go onto their stomach. To encourage that segmentation though, or the rotation of the spine, we'll gently apply a little bit of maintaining pressure, not so much force pushing down, just a hand here to bolster, preventing the shoulder from coming up. And that will elicit that rotation in the spine. When the knee is as far as it comfortably can go and you see rotation here, you can gently let off the shoulder and allow them to go onto their stomach. From here, you can still engage in those prone prop activities onto the elbows, working with serving with a toy, getting the neck into rotation, and then weight shifting onto the elbows, more so one side than the other and vice versa. Those would be my favorite activities for a very good number of infants and the promotion of their motor skills, exposing them to as much tummy time and floor play as possible, allowing them to explore their environment and play independently as possible would be my big take-homes.